All right, let's dive in. Today, we're talking about a huge shift in dental care, a new way of thinking that literally breaks down the clinic walls to get care to the people who need it most right where they are. So let's start with a really stark number. 60 million. That's how many Americans are living in what people call dental deserts. These are areas with a huge shortage of dentists. For about 1 in 5 people, just getting to see a dentist is a major challenge. That's a gap we absolutely have to bridge.
And that really gets to the heart of the problem. For millions, the old way of doing things, where you have to travel to a specific clinic, it's just, well, it's broken. It's a system that, without even meaning to, is leaving the most vulnerable people behind.
Now look at this. This slide lays it all out, doesn't it? The old way is static. You have to go to the care. But the new way? It's dynamic. The care comes to you. We're talking about bringing dental services right into schools, into care homes, local community centers. It completely flips the script.
And these barriers, they are so real. Just try to imagine living in one of the 38% of rural counties that has 0 dentists. Or what if you don't have a car and you have to take a day off work you can't afford? These aren't just little inconveniences. They're massive roadblocks to getting basic healthcare. Okay, so what's the fix? Well, the solution is all about rethinking who can provide care. It's about empowering the entire dental team, not just the dentist, but hygienists, nurses, assistants, to be the first responders for oral health out in our communities.
And this, right here, is the key. Your local dental hygienists and nurses are in the perfect spot to lead the charge. They can handle the preventative care, they can gather all the diagnostic info, and they can be that essential link connecting patients back to a dentist who might be miles away. This quote just nails it. A dental nurse's role completely transforms in this model. They're not just assisting in a clinic anymore. Now they're tech-savvy coordinators, handling digital records, setting up virtual consults. They're the ones making sure the whole system actually works, acting as that bridge between the community and the dentist. So how does this all work in practice? Well, it's all powered by a brand new set of tools. We're talking about the technology that makes this whole digital connection between the patient and the clinic possible. And the big idea at the center of it all is teledentistry. It's not one single thing, really. It's a method. It's simply using technology to make distance irrelevant, whether you need a diagnosis, a quick chat with your dentist, or just some education. And it basically comes in 2 main flavors. You've got synchronous, which is pretty much what it sounds like, a live video call with your dentist, real-time, back and forth. Then you have asynchronous, or store and forward. That's where a team member on the ground collects info, like photos, scans, x-rays, and sends it securely to a dentist to look at later. Think of it like a secure email with all your dental info. And the amazing thing is, the gear to do this is more available than ever. We're talking about high-def intraoral cameras that fit in the palm of your hand, portable digital x-ray machines, and super secure platforms to send all the info. It's like having a whole dental diagnostic lab in a backpack. This is a total game changer. I mean, think about it. In a dental desert, there might not be a dentist, but there's probably a room in a community center. A trained dental nurse could go there, use a portable unit to take routine x-rays, and boom, the images get sent to a dentist for review. And the radiation from a modern digital x-ray, it's about the same as a 2-hour flight. It's super safe. It might not be the absolute ideal scenario, but it is a million times better than getting no screening at all. Okay, so the teams out in the community, they've used the tech and they've found a problem. What can they actually do right then and there? Well, that's where treatments like silver diamine fluoride, or SDF, come into play. It's this amazing liquid you can just paint onto a cavity to stop the decay right in its tracks. No drilling required. It's a fantastic tool for preventing problems and providing immediate relief. And applying it is ridiculously simple. You just clean and dry the tooth, use a tiny brush to apply the SDF, and let it sit for a minute. That's it. It's fast, it's non-invasive, and it's absolutely perfect for a setting like a school or a care home. You might be thinking, okay, this all sounds great in theory, but does it actually work in the real world? The answer is a resounding yes. Let's look at a model that proves it, the virtual dental home. This whole concept was pioneered by the incredible Dr. Paul Glassman. His virtual dental home, or VDH, system was designed to do exactly what we've been talking about, to stop waiting for people to come to the clinic and instead take the care to them. And the results? They speak for themselves. Check out the cost savings. One study found that patients in this kind of system had annual dental costs that were about $75 lower on average. Why? Because you catch problems early, you prevent bigger issues, and you save everyone money down the line. But this one is even more powerful. It's estimated that with the virtual dental home model, up to 80% of kids could be kept completely healthy with that health verified by a dentist without ever having to step foot in a traditional dental office. Just think about the impact of that for a second. So we have the technology. We've got a model that's proven to work. We have an entire workforce of dental professionals ready and willing to step up. So what is the final barrier? What's stopping this from being everywhere? I mean, it's the obvious question, isn't it? If we have a solution that works better, saves money, and improves people's health, why aren't we all doing it already? Well, the biggest hurdle isn't the technology and it's not the science. It's the paperwork. It's the outdated rules and regulations that just haven't caught up to reality. And these policy gaps are the real roadblock. I mean, take the UK, for example. Their dental profession is still being governed by the 1984 Dental Act. 1984. We didn't even have mobile phones then. These laws were written for a world that doesn't exist anymore. We need regulations that understand today's safe, modern technology. The whole point should be to protect the public with a service that helps them, not to protect an old, expensive system that stops trained professionals from doing their jobs. So I'll leave you with this to think about. At the end of the day, is dental care a physical place you have to travel to, or is it a service you should be able to receive wherever you are? How we answer that question is going to define the future of oral health for millions. Thanks so much for joining me.